So this is a recording for my men out there that are suffering from low energy, not feeling themselves, decreased performance, and they want a little bit more out of life. I tell all my patients we cannot stop the aging process, but it's so important to just be able to find that happy medium where you're living your best life. And this is something that can definitely help you do that. So today we're going to be doing Biote male pelleting for a man that has basically a lower level of testosterone. So literally the things that I want you to know is that with the Biote method, we aim for the men to be higher than 900. Higher than 900 means that our guys definitely, they feel more like themselves, they have more energy, their brain fog is on point, their performance is great. These are all the things that makes a huge difference in the way that our men feel. Okay, so stay tuned. We're gonna follow us into the room right now. So come on with me. We're gonna have our gentleman here. And again, we're gonna do it from start to finish, okay? All right, it's just Dr. Evans coming in. And we have our male here. We also have Kayla here. Perfect. So I'm going to have you take a look at our tray that we have set up. This is our Biote Hormone male pellet tray. These are our wonderful, beautiful pellets that are in here. Again, this because it is sterile. I don't want to touch him. He's basically getting 2,300 milligrams of testosterone today. We have our sterile things that are here. We have our lidocaine to numb our male up with. And this is where the magic happens. So I'm going to go ahead and sit him on up here. So we like our men to be very, very comfortable. So what we do is we get our men nice and comfortable for their procedure. So I'm just going to arrange him now for pellets. There's a couple different ways to place pellets. One is actually in the buttocks. It's the classic way for placing pellets, but I've learned through time, of course, women have more butt fat than guys do. So literally what we want to do is we're going to actually place him in its side. Okay, so let me go ahead and get our male nice and comfortable here. Okay, so what you're going to do, you're going to turn towards the wall away from me. Have our wonderful model here helping us today. Go ahead and slide on up for me, please. A little bit more. Awesome, a little bit more. Perfect, good job, excellent. And we're gonna give feet a little bit of very comfortable here. Awesome. And then we're just going to expose our site of placement. So here at our practice, I love these particular beds that can get our men as comfortable as possible. So this is a great way to bring those levels up. For the testosterone levels, we'll meet guys all the time and they actually have a lower level of testosterone. So what we want to do now is we figure out, where you're at. We figure out where you need to go to, and then we start helping you make up that difference. And we really try to optimize it so it's very custom. So we want you to feel your best. We don't want you to have problems with anger. We don't want you to have problems with, acne things. It has to be properly balanced. And that's really one of the best ways to do this. Okay. So I'm going to have you turn on over for me a little bit more to the side. Perfect. And are you comfortable right there? Let's get a pillow for his, got a pillow for his arm too. So it's very important to make sure that our patient is comfortable. We do this, ladies, we do this for y'all too. So we want y'all to be just as comfortable as our guys do. And what we want to do is we want this to be right in what we call the love handle area here. And turn just a little bit more for me, sister. Thank you so much. We want it just right in the love handle area right there, okay? This is basically where our pellets are going to land. So I'm just going to mark our spot over here. Kayla, can you put a little bit of light on here for me, please? Thank you so much, okay? And this is just my fingernail. I'm just marking the area here. Now we have our male model. We're just getting this at a little different view so you can see a little bit better. Again, the pellets are going to be spread out through here. So the first thing I'm going to do is numb them up, okay? You're going to feel me touch. 1, and this is the worst part. 1, 2, 3. Pinch, burn, 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 burn. The lidocaine burns, unfortunately. So it's kind of one of those things. It is what it is. Just nice, easy breaths. Nice, easy breaths. You're doing beautiful. You're doing absolutely perfect, okay? Next thing I'm going to do is I'm going to numb up a little bit more. And I'm going to lower the bed just a little bit, okay? You're going to feel me touch you, okay? Again, 1, 2, pinch, 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 pinch. Burn, burn, burn. Burn, 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 burn. Burn, 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 burn. Burn, 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 burn. And what I'm doing essentially is that I'm numbing up the entire area where our pellets are going to be placed. Again, we want them to be as comfortable as possible during this process. And just to let you know, the lidocaine is the worst part, and it should be going away right now for the burning. Lidocaine is considered, it's an acidic substance, so literally that's why it burns. Next thing I'm going to do is I'm going to make everything nice and sterile. So this is some of our chlorhexidate soap here that we're using to make the area nice and sterile. So if you're one of the guys that are squeamish about needles, you don't have to watch this, okay? But just know that yes, there's a better way to get those numbers up versus just using, the classic injections on a weekly basis. Another thing I was going to tell you, the reason why this is the preferred method when it comes down to doing hormone balancing is it's for a couple different reasons. One is that it lasts 4 to 6 months. So literally you're going to be getting 4 to 6 months of great hormonal levels, and those good levels means that they're optimized. So optimized means that, that they're high enough for you to feel better on a longer duration of time. So when you get optimized, the higher they are, the longer that they're up, then you start getting things like reduced chance of brain fog. It really helps those muscle mass, which then again helps your performance. It just becomes like multifactorial in terms of just feeling good on a regular basis. And really, that's what you want. The problems with the shots sometimes is you get more of like a yo-yo effect where you feel good on Monday, and then by like Thursday, Friday, you're like tanking and it's not even time for your next shot. So again, all guys are different. This is just one of the optimal ways. The other thing about this that I like this over the actual injections is that the injections, they commonly contain something called peanut oil. And that's really what the testosterone is dissolved in. So if it includes the peanut oil, it's actually inflammatory, versus something like the pellet is actually anti-inflammatory. So anti-inflammatory means less joint pain. It's better for your heart, better for your body. It causes vasodilation, which can then decrease your chance of your heart having to work so hard. It also will enhance the performance in the bedroom, if you know what I mean. So yeah. Okay, let me go ahead and move on to the next part here. Just gonna put my sterile gloves on. And literally our guys, all they feel is just pressure when we do this, okay? And that's just because the lidocaine works so darn good. And I'm just kind of massaging in here a little bit, making sure the lidocaine works really good. I'm gonna go ahead and check our dosage to make sure we do have our 2300 in here, just for a safety check, make sure everything's perfect. So now what we're gonna do is we're gonna go ahead and start, okay? And I always ask my guys, do you feel anything sharp, hun? Okay, good. You're gonna feel me touch her, okay? If you do, we have extra pain medicine for you. Do you feel anything? You promise? Okay, good. And you wouldn't lie to people that you don't even know, right? Yeah. Okay, good. Excellent. Just double checking. So that's important. Again, really all this person should feel is a little bit of pressure, okay? Can you slide back towards me just a little bit? Perfect. Right there is excellent. Just like that. Fantastic. Okay, a little bit of pressure now, sweetheart, okay? Do you feel anything? Okay, excellent, excellent. So this is our Biote Pellet introducer. It's what we use to place our pellets in. And literally how this works is that we just go one by one in terms of like placing the pellets. Again, this is all of my sterile area here, okay? And again, I just place them one by one, okay? So we got one in, and it should be nice and slow and easy for our gentlemen. We want them to be as comfortable as possible when we do this procedure. Comfortable as possible. So again, we're just moving right along. So when we place the pellets, we don't place them on top of one another. We kind of spread them out a little bit. This is why you see me moving the little trocar around as we place it. So if you imagine like a barrel of a gun, when we're placing this, we place them at the 6 o'clock. I'm going to move over for just a second. So again, we're going to go ahead and continue on with our pelleting now. I just asked our gentleman if he feels anything unusual or any sort of pain at all, and he laughed at me. Okay. So again, I love this for our guys because it literally truly affects how someone feels, how they, how they act at home, and all that goodness. I actually tease my guys because I tell them, I said, it's going to make you a little bit nicer, So that's a good thing. Are you laughing at me still? Okay. Perfect. So I won't say it, but no, I won't say it. I was going to tell you that his wife is actually the one videotaping, so she was probably going to be like, I'm going to kick you later, so. But you better not say anything. So yeah, we're doing absolutely fantastic. Okay, awesome. So this is basically how we do our pellets. I'm just going to go ahead and finish, and then we give our guys post-op instructions about what to expect, making sure the bandages stay on for 7 days, keeping everything clean and dry. So again, this is Dr. Evans. I'm just going to go ahead and finish here, but we will see you later. Don't forget to hit the subscribe button, the like button if you want to see more videos like this. Also, feel free to comment. I love answering your questions just to, be able to help people. That's really what it all comes down to. Take care. Again, it's Dr. Evans from Sugarland Medical Spa.